Touching the critical sites of sterile components while compounding is the most common reason for contamination of pharmacy compounded sterile preparations. Proper hand washing is a critical step in preventing contamination. The chemical action of soap, along with the friction of rubbing your hands together, helps rid the skin of dangerous germs and bacteria. Now let's review the importance and proper procedures of hand washing. Before using any equipment or performing any compounding, you should first remove all jewelry, including rings and watches. Then, using warm water, wet your hands and wrists up to your elbows and let the faucet run the entire time you are washing your hands. Now, thoroughly scrub your hands, nails, wrists, and forearms for at least 30 seconds with a brush, warm water, and appropriate bactericidal soap. Be sure to scrub your palms, the backs of your hands, between each of your fingers, under your nails, and around your cuticles. After scrubbing, rinse well, holding your hands upward towards the water so the dirty water and soap runs toward the elbows and not the hands. Hold your fingernails under running water to make sure they are properly rinsed. To finish, use a clean, lint-free towel to dry your hands and use a towel to turn off the water. Now that your hands are cleaned, don't touch anything except for garbing supplies. To avoid recontamination, do not leave and re-enter the compounding area without performing proper garbing and hand washing techniques. Many institutions require the use of sterile gloves to reduce touch contamination, but don't let that give you a false sense of security. Sterile gloves are sterile only until they touch something not sterile. If you must scratch or touch your face while wearing gloves, they will need to be changed or disinfected. Please note that if you have an upper respiratory tract infection, open sores on hands, or any other infectious disease, inform your supervisor or consult your institution's quality assurance procedures. Hand washing is one of the most important ways to prevent microbial contamination. Your hands must be properly cleaned before and after any compounding takes place. Strictly following these guidelines is the first line of defense for protecting against the spread of microorganisms. Now stop the